moving along, you know, in Africa, one of the things that we value the most is the art of storytelling. Grandparents sit with their grandkids next to the fire, and oral history is passed from generation to generation. This afternoon, we want to have our own version of the fireside chat as we invite our esteemed partners to tell the story of FAH through their eyes and through their voices. We would not be able, as I said, to do the work without their support and without their cooperation, as well as the support and the cooperation of the FAH team that Angela spoke about. So we are going to invite a panel to the fireside chat, and I'm going to pose a question to them. As we do this, please remember to drop any questions and comments into the chat box, and also remember to interact with us through our social media. The very first panelist that I'm going to invite to the fireside chat is Mr. David Kiuluku, Director of Health Planning for Makueni County. Makueni County is one of the counties that we are very proud to work with. And actually is the county where we developed our very first ever community health policy. So Mr. Kiuluku, welcome this afternoon. And the question that I want to pose to you is, what is the role that FAH has played and continues to play in the community health systems landscape? Thank you so much, and over to you.
So good evening, team, those who are in Kenya, those who are in the rest of the world, probably good morning. I'm David Kiuluku, and I must really thank Stembindi for pronouncing my name correctly. And I really feel honored for that. And I'm here as Director of Health Planning from Makueni County. And this journey of a collaboration between FAH and Makueni County, and specifically the Department of Health, began in late 2020, sometimes November, when we signed the Memorandum of Understanding. And what was our on table and what we thought then was our strategic need was we lacked a strategy for community health strategy, and therefore we requested FAH to assist us in coming up with that document. And sometimes December, we had a situational analysis with our key stakeholders, all in the ecosystem, the Department of Health and all other partners who are in the space. And we were able to really scoop around all the documents, the desk review, and we really came with a very robust situational analysis for the Makueni County and also the neighboring sub-counties. And along the way, we realized that we had a policy for the strategy, but when we viewed the two documents, the draft policy and the strategy, they were not really talking. The strategy that was led by FAH was very deep, yet the policy needed to be the policy, given that is the mother document. And therefore, we also requested the FAH to assist us in coming up with the policy. And this journey, therefore, really began in earnest. And one of the things that we felt as a department, and we are really indebted to FAH, is that the process was really guided by data, where we could even go to the field and get up to date situation, and many things and many gaps were able to be pinned out. And we also gave a solution to the same through the policy. And I'm happy to announce that both the document, the strategy and the policy, we were actually launched in a very colorful ceremony. And that is not enough. We have been able to start implementing the strategy, where currently we have close to 6,000 CHVs. And through the policy, we are able now to pay them 2,000, just a remuneration, to take care of the needs And also, the CHVs were not well equipped. So this year, we actually purchasing a kit each for them, where a kit consists of the bag, the jacket, the identification jacket. Then we have also the ID, which is identification document for the CHVs. Then we have also a glucometer and a BP machine. And this will go toward the screening of the NCDs, specifically the diabetes and the hypertension. And of course, there are some pending issues that are still on the table and that we are trying to at least finish before this year. And one of it is the investment case. Then we have the advocacy toolkit for all the stakeholders. Then we also need to do the resource mobilization and also mapping of the same. Then through this strong collaboration, we look forward to making our community strategy more sustainable, where through their activities, they are able to generate income to sustain their upkeep. And this will enable us as a department realize the high retention and also the retooling of the strategy, so to speak, in terms of the skill, in terms of the equipment, mobility, making these people move from household and to household. And still through the FAH, we are designing a tool for the mapping of all the household, which will be like a census, not only to get the health status, but also the economic status. Because as we were aware, really this is a very rural county where majority of the folk lives below $2 per day. And in some sub-counties, there are some regions within the county, the poverty level goes as high as 64%. And this becomes an area of priority to address the health issues. We also been able to drive what I would call a community scorecard, given that our resource envelope is still very much stretched. And therefore, for intervention, there is need to do what I would call targeted intervention. And this can only be as a result of the scorecard, where certain communities are doing poorly. Then the small resource that we have, we kind of direct it to those regions, and I'm sure that will have a high impact analysis and see how much we have been able to leverage and achieve much of what. Thank you, Sizwile, for the opportunity.
Hello, my name is Wendy Wahusama, and I'm the Partnership and Grant Management Associate at Financing Alliance for Health.
My name is Joyce Wanjeri, and I'm the Project Officer at Africa Frontline Fast Initiative.
I enjoy working at FAH, and it's amazing to see the impact and progress we have made in the last 5 years, especially in us recognizing over 450,000 community health workers in policies and programs.
In the last 5 years, I've enjoyed seeing the Financing Alliance for Health birth and collaboratively bring to existence bold ideas such as the Africa Frontline Fast, a multi-billion-dollar community health initiative.
I'm so excited about the next 5-year strategy, and I look forward to us achieving much more as we strengthen and sustain our impact in developing community health systems.
I look forward to seeing African countries channeling funding to strengthen and scale their community health systems. I also look forward to seeing more community health workers paid, trained, supervised, and their efforts acknowledged.
Thank you so much. Thank you, Mr. Kiuluku, and thank you to the FAH staff in that video. At the core of our work and in the heart of our work is community health work. And we do what we do because community health workers are very important to us. And joining us today, all the way from Tharaka Nithi County in Kenya, is Eurydice Gatwiri, who is a community health worker in that county. That is a county that we work in, and just like Makueni, it's a county that we are very proud to be working in. Welcome this afternoon, Eurydice, and I would like to pose that same question to you. What is the role that FAH has played and continues to play in community health systems landscape? Over to you.
Thank you. Thank you very much. Hello, everyone. I am Eurydice Gatwiri, a community health worker from Tharaka Nithi County. I must say I'm a very excited community health worker when I'm working for the community. We came to meet with the Financing Alliance for Health in 2021 January, and that was a turning point for community health in Tharaka Nithi. I must say Tharaka Nithi is the best in the health department. When Financing Alliance for Health came, the first thing, the stipend we were getting was of 2,000. And from when the financing came, our stipend went to 3,000 per month. Thank you, FAH. The other thing, since they came in Tharaka Nithi and advocacy, our voices were heard. When any policy in the county government was to be implemented, they used to come and consult us the bottom-up way. We are included in any lawmaking. Since 2021, when the Financing Alliance for Health visited us, we received our BP machines, which Makueni has none. We have the all equipment, the first aid kits, a lot of capacity buildings. I think we are now qualified to be nurses. Thank you, FAH, for supporting us. I must say, Tharaka Nithi has become a benchmarking. Many counties are coming to see how we are working. Household mapping, we are the best. Data collection, the syncing is up to date. We have smartphone. This is from the county government. Our work is very easy. The way we give our monthly reports is now 99%, and I think no other county like my county. And if you, before 2021, when FAH came, I think we were almost the last. But when they came, they gave us a lot of training, a lot of networking. And to surprise you, we have a lot of online trainings as community health workers. That's global, by the way, not only in Tharaka Nithi. We have a community health worker of Kenya. We are training online. We are getting certificates. Like in my county, we have around 5 certificates. It's free. Thank you, FAH, for supporting us. The other thing, I have a motorbike. This is as a result of being a community health work. Every morning during household mapping, my work is very easy. I can assess 40 families within 2 hours. Thank you for the support. The other thing, we are being involved in global training. When FAH have a global training, they are involving us. Thank you, FAH.
I'm Dennis Munguti. I have financing manager at the country engagement workstream, and it has been an amazing 5-year-long journey for the Financing Alliance for Health, a journey of resilience, a journey of growth and impact For instance, together with our ecosystem partners, we've been able to mobilize over $0.5 billion to community health programs and systems across the region. For our next 5 years, I do look forward to expanding our wings of support to more countries, to more governments, and to more community health workers.
I'm Dorothy Wabinya, Country Engagement and Support Analyst, Financing Alliance for Health. In the last 5 years, Financing Alliance for Health has played a critical role in supporting governments in walking journey to self-reliance through advocating for more domestic resources allocated to community health. And in the next 5 years, I would say the greatness of the organization is not where we are currently, but the direction that we are moving. Primary healthcare being one of the fundamental foundational pieces of our healthcare systems, Financing Alliance for Health in their current strategy has plans to expand their wings to primary healthcare, a challenge that I'm really looking forward to.
My name is Lucy Moreithi, a Country Engagement and Support Analyst with the Financing Alliance for Health. Over the last 5 years, I've seen tremendous increase in domestic resource financing, specifically for community health with governments. And in the next 5 years, I'm looking to see a more supported, professionalized, and equipped community health workers who are effectively performing their work to improve the health of the communities. Thank you.
Wow, amazing. Thank you so much. I must say that I was really, truly inspired when first Mr. Kiuluku spoke and again when Eurydice spoke. Some of the things that are coming across from what they shared really show that the work is never in vain. I am glad to hear that the stipends have gone up, but more importantly, that the voices of the community health workers are being heard. So they are not just shouting into the desert or into the wilderness. It is truly great to see that the strategies are being implemented, the policies are being implemented. Thank you so much to both of Mr. Kiuluku as well as Eurydice for really inspiring us this afternoon. We continue with our fireside chat, and as we continue, let me just remind everybody that if you've got any questions or comments, please do drop them via the Q&A box at the bottom of your screens, and we will get to them later on. But now, welcoming Catherine Harrison, who is the Associate Principal for Portfolio and Investments at the Skoll Foundation. We are very excited to welcome you, Catherine, this afternoon, and we do value the partnership that we have with Skoll. And also one of our highlights for 2022 was being a Skoll Award winner. So we are truly honored to have you with us this afternoon. Welcome. And the question to you will remain the same. What is the role that FAH has played and continues to play in the community health systems landscape? Thank you, and over to you, Catherine.
Hi, everyone. Very happy to be here, and congratulations to the FAH team on the strategy launch. Yeah, as you mentioned, we first got to know FAH as we were considering them for a Skoll Award. And I think what we really came to understand during that process was that FAH had zeroed in on a fundamental but often overlooked aspect, part of the challenge in scaling and sustaining community health systems, which was this financing piece. And meanwhile, that they were addressing that challenge at multiple levels of the system. So both building capacity within ministries of health and across ministries of health and finance to establish the investment case and to secure funding for community health. But then really leveraging the lessons that they learned from those direct country engagements to drive a much broader advocacy agenda for the space. So I think about the role that they played in documenting the $2 billion funding gap for community health alongside USAID, a gap that we now know has widened to over $4 billion a year. And the work in 2015 to establish that investments in community health workers yield a 10-to-1 return. I think that work and that thought leadership has been really core to FAH's unique value in this space. And I'll close by saying I think it's a testament to FAH that just a year after celebrating their Skoll Award, we're now walking alongside them in a new partnership, a new initiative, as Angela talked about, which is the Africa Frontline First initiative, which aims to strengthen and scale community health systems across 10 African countries in the next 10 years. I think that initiative is in many ways sort of bringing to life this vision of impact that FAH and its partners have really long held for health systems across the continent, and just, so glad from the SKOL perspective to be a partner in that, and to continue watching FAH evolve and grow, and very happy to be here today. So thank you.
Bonjour, je suis Christiane Cognan, Partnerships and Grant Management Associate pour FAH. Au cours de ces 5 dernières années, nous avons réalisé un travail incroyable en supportant les gouvernements africains à renforcer leur système de santé communautaire. Pour les 5 prochaines années, j'ai vraiment hâte de voir comment nous impacterons et renforcerons davantage les systèmes de santé communautaire de façon durable. J'ai également hâte de voir comment notre travail se reflétera au niveau de l'amélioration des soins de santé primaire, au niveau de la mobilisation de ressources nécessaires à l'achèvement de la couverture maladie universelle et de façon plus globale au niveau de la sécurité sanitaire pour tous.
My name is Said Gaya, and I am a fellow with the Financing Alliance for Health. I work with the Country Engagement Workstream. It's been an exciting experience working in a truly collaborative and diverse workspace. For me, in our next 5-year strategy, I look forward to FAH expanding its footprint on the African continent, collaborating or partnering with more institutions and with government to see that community health is prioritized and that community health workers are properly incentivized and institutionalized. And of course, more countries can now move a mile further towards universal health coverage.
My name is Wangwe Mbiriti, and I am the Impact Tracking and Reporting Associate at the Financing Alliance for Health, FAH. For the time that I have been at FAH, I have really enjoyed being at the forefront of impact, and particularly ensuring that the work that we do is tracked, measured, and communicated in a powerful and compelling manner. For the next 5 years, I look forward to entrenching our impact and story within the primary and community health system, and more so ensuring that we at FAH measure, track, and communicate what matters.
One of the things that Catherine mentioned when she was speaking is the Africa Frontline First, which is a collaborative initiative. And one of the partners that we collaborate with on AFF is the Community Health Impact Coalition. And joining us this afternoon is the co-founder and CEO of Community Health Impact Coalition, Dr. Madeline Ballard. Welcome, Dr. Ballard. And the question to you is, what is the role that FAH has played and continues to play in the community health systems landscape? Thank you.
Thanks, Israeli. I think it's important to start just briefly by setting the scene. We're talking about the continent of Africa. 80% of CHWs on the continent are unsalaried. So the accomplishment of Eurydice and FAH is right now an outlier, but soon to be, I think, the future of the entire continent. Right now, we have this dual-sided human rights issues where CHWs are both exploited and less effective for their patients. And I'm speaking to you, as Israeli said, on behalf of Community Health Impact Coalition, which is a team of thousands of CHWs and aligned health organizations that are making professional community health workers a norm. So as a coalition and as a field catalyst, we have a bird's eye view of the community health movement. And we're not supposed to have favorites, but I am here to dispassionately tell you that Financing Alliance really does stand out as an irreplaceable part of that ecosystem. All of the coalition's work, whether it's research to create professional CHW guidelines, advocacy to increase professional CHW funding, or CHW organizing to demand professional CHW policy, is about creating an enabling environment for ministries of health to make pro-CHWs a reality in their countries. But Financing Alliance for Health actually gets the budget line. We collaborate on, as Israeli said, on addressing systemic financing challenges, but each country is different. And FAH are the go-to health financing experts who do both top-down work on funding flows and the nitty-gritty work of accompanying specific ministries of health and finance, as we heard, regional partners, to cost their strategies, to develop their investment case and get those domestic resources flowing. So, and not only that, as we heard, they also develop essential finance-related global goods that then make it easier for the next country to do the same and continue to foster that public sector leadership across the country. So you're dealing with a really unique set of expertise, top down, bottom up, and really such an essential partner to us and a big engine of the entire community health movement and universal health coverage movement. So really proud to partner with you, and thanks for letting me give this endorsement, because it's really my pleasure.
Hi, my name is Sizwile Sibindi, and I'm the Head of Operations and Risk at the Financing Alliance for Health. What I have loved about Financing Alliance for Health in the last 5 years is that we have truly embraced a culture of diversity. Just looking at our team, we've got team members from all around the globe, yet we continue to be a truly African-based and African-led organization. I look forward to us taking up space and solidifying our position as a leader in the health financing sector, particularly in Africa.
My name is Shivani, and I'm a health financing fellow at the Financing Alliance for Health. In the last 5 years, it's been really inspiring to see the growth and impact of Financing Alliance for Health in building community health systems, not only through the work with country governments on ground, but also through thought leadership and implementation of big innovative ideas. And I really look forward to this next phase as we grow much faster, create a bigger difference, and further the vision of mobilizing financing to improve health for all.
Thank you so much. And thank you, Dr. Ballard. You know, when we started the session, I did say that this was like an oral history session, because we are sitting next to the fire. Oral history is being passed from generation to generation. And we all know that what happens with oral history is that sometimes things get lost in translation or messages get changed over generations. And for me this afternoon, what I heard was that Dr. Ballard said FAH is her favorite. I don't know what everybody else heard, but that is my truth and I'm sticking to it. And now, moving ahead, we are going to welcome one of our board members, who is also the board co-chair for Financing Alliance for Health, Mr. Nan Chen. We are very honored to welcome him this afternoon, because our board is who keep us, you know, anchored, and they keep us in the straight and narrow, making sure that we are accountable. Nan, it's a pleasure to welcome you, and we would like to hear from you this afternoon. What is the role that FAH has played and continues to play in the community health systems landscape? Thank you.
Thanks, Sizwile, and congratulations to the entire Financing Alliance for Health team and the wide family that the Financing Alliance has really built over the last 5 years. It's an amazing accomplishment to see and to reflect back. To those of you in the early years, Angela, Liza, and others, I can remember the barely managed chaos of those early years. And if only you could rack up the therapy hours in financing dollars, we'd also be we'd be really hitting some of those targets, increasing them. But it's incredible to see where we are today. To go from an idea to an early organization to now something that's really starting to run and rapidly become and is that go-to financing institution on the continent. So when I think about what Financing Alliance is, the role it plays in this space, I think that, to me, the analogy, the imagery that stands out is that Financing Alliance for Health is a bridge. It's a bridge between the Ministries of Health and Ministries of Finance. We've been in so many conversations where it feels like we're not being understood. The health actors are saying, why don't the financiers get that health is money, health is economic growth? And the budget holders are saying, like, what are all these health people talking about with their, with their ROI analyses or their interventions in vertical diseases? Like, tell me where the money is. And so Financing has been a bridge for all these years across those actors, from Ministry of Health, Ministry of Finance, It's also been a bridge from evidence to action. Some of the work that you heard Madeline speak about and Catherine, if you hear about the 10-to-1 ROI for community health programs in the world, that's from the Financing Alliance for Health. If you hear about the community health worker financing gap, that's from the Financing Alliance for Health. So that bridge from evidence generation to action has always been there. You are also a bridge between institutions, between layers of the work, between national, regional, subnational work to regional global stages. It was really great hearing from our colleagues, from David and Makueni and Yurdes and Tarakaniti. It's really amazing to hear the impact that's happening, their stories, their success, and their vision elevated and disseminated across all these places that financial science is bridging, not just the evidence gap, but also the perspective, the voice shift. You're bridging places where across people that otherwise wouldn't really be working together across institutions. I recall with a lot of the Africa Frontline First work that I've had the privilege to work alongside the Financial Science team with. Sometimes you're sitting across the table with a big institution, a big, huge multilateral partner, and you're across the table looking at each other with shady eyes and thinking, are we really going to work together? Are we really going to actually, come be able to speak to each other in a way that feels like partnerships? And now where we are, we're not sitting across the table, but we're sitting next to each other, looking towards that same vision. And so this allegory, this imagery of being a bridge really resonates with me. Lastly, I think, maybe to sum it up, I think the Financial Alliance is a bridge from today's reality to the future. I really love this quote from William Blake, who writes that what is now proved was once only imagined. And so FAH is that bridge from what's possible today to that adjacent possible tomorrow. And it's a real pleasure to see and be along you with the journey, in this journey, and congratulations on everything.
Hello, my name is Jacqueline Wanjiro, HR and admin here at Financing Alliance for Health. I've really enjoyed seeing the growth within the team, within our scope of work. In terms of country engagement, the kind of work that our amazing team has done both in Kenya and within Africa. And I'm still grateful for the leadership of our CEO, Dr. Angela Gishaga. And I look forward for more amazing opportunities within community health workers, having our CHWs become institutionalized, that is recognized as an institute, and looking for more growth and expansion, both within our Kenya counties and also at Africa level. So happy for the next strategy and looking forward for what we have in store as FAH.
Je suis Tapsoba Boukari. Je suis l'associé des coûts et d'investissement en santé pour la région francophone à Financing Alliance for Health ou Alliance pour le financement de la santé en français. Je suis du département qui s'occupe de l'engagement de l'organisation dans les différents pays. Je vis et je travaille à Lomé, au Togo. Au cours de ces dernières années, j'ai beaucoup apprécié de travailler à Financing Alliance for Health dans les pays francophones, notamment au Togo, et de voir les progrès et l'impact que nous avions eu dans la dynamique de l'harmonisation, de l'optimisation et de la professionnalisation de l'activité des agents de santé communautaire dans ce pays, mais aussi sur la mise en œuvre du programme d'accompagnement de la femme enceinte et du nouveau-né. Alors, dans mon rôle d'appui aux pays francophones dans le développement de leur système de santé communautaire, j'ai hâte de voir ces pays faire de la santé communautaire un niveau à part entière de leur système de santé, ce qui permettra de progresser résolument vers l'instauration de la couverture sanitaire universelle tant souhaitée. Je vous remercie.